Hi, I'm Dr. Kushal Hippalgoankar, Consultant Orthopedic Surgeon at Sunshine Bone and Joint Institute in Hyderabad. I think one of the highlights of robotics, the most powerful advantage of robotics is its ability to assess the soft tissues. That means the laxity patterns, the tightness patterns, whether it's the medial side, lateral side, in extension or flexion. That assessment which we earlier didn't have with conventional. Robotics has come in and allowed us to assess those. Now what we do with those gaps is still evolving. Whether you want equal gaps in extension, flexion on medial and lateral sides, whether you want unequal gaps, how much of it has to be unequal, all these are still evolving. But the fact that we have an understanding and we can go and get what we want to achieve is a big advantage of robotics. Another beautiful advantage of the robotic systems, where implant alignment has now a completely different dimension. That means you don't have to be restricted to the mechanical workflow which conventional techniques allow us to or permit us only to do. In robotics, you can explore the alternate alignment methods by placing the implants, whether it's the femur or tibia, in slightly different ranges which can be assessed and properly, accurately placed as per the evidence that the robotics perfectly puts the implant where you want it to put. 100%. Robotics definitely allows a personalized planning which earlier was not possible with the conventional techniques, because now we are able to understand what is the native or natural alignment of a particular patient, how is the joint line behaving, whether we want that joint line to be reproduced, whether we want the same alignment to continue or not. It's our decision. At least we have the ability to take that decision now, unlike earlier times when we didn't have that.